Hello, everyone, and welcome to our question lab. Thank you guys very much for joining. For those of you who came last week, thanks for coming again. For those of you it's your first time, welcome to the question lab, and hope you guys enjoy and learn a lot from what we're doing today. Today, we're going to be covering neurology and doing some question dissections on the topic of neurology. Before we begin, let me introduce myself and the team we have with us today. My name is Sean. I have been with Scholar-Rx for a little over a year. I spearhead and run their RX Coach program, which is our new one-on-one tutoring service, which I'll tell you more about later. We have a really great webinar today. We have a great raffle for you at the end too, so make sure you stick around. Leading this webinar today is Dr. Paras Vakaria. I'll let him introduce himself.
Hello, everyone. Like Sean was saying, thank you, Sean. My name is Paras Vakaria. I graduated from pharmacy school in St. Louis, Missouri, and then after that, I attended medical school back home in Michigan, and I am now doing my residency in dermatology at UT Southwestern in Dallas, Texas. I've been with USMLE-Rx as an RX coach for about 3/4 of a year now, and I've worked with various students one-on-one coaching, primarily for USMLE Step 1.
Wonderful. Thank you so much, Dr. Vakaria. In addition to that, we have some wonderful panelists tonight. They'll be helping to answer any questions that you might have. If you have questions, you will see a question box there, and you can type your questions out, and our panelists will do their very best to answer those questions for you. Our first panelist is Dr. Christine Lomigwin. I'll let her introduce herself.
Hi, everyone. My name is Dr. Christine Lomigwin. I have a similar story to Dr. Vakaria. I went to engineering school first, and then I went to my parents' home country of the Philippines to do medical school. So I'm an international medical graduate, and I am currently an assistant professor of pathology and medical education at Lake Erie College of Osteopathic Medicine. And I've been working for First Aid or USMLE-Rx doing the express videos for about 2 years now.
Awesome. We're so happy to have you on board. And we also have another one of our RX coaches, and that's Mark Heslin. Mark, I'll let you introduce yourself.
Hey guys, my name is Mark Heslin. I'm a current third-year med student at Cooper Medical School in Camden, New Jersey. And like I said, I'm one of the Scholar-Rx coaches, and I'm happy to answer any of your guys' questions.
Awesome. So now that you guys know some of our coaches and our panelists, let's get to know you a little bit. I'm going to ask you guys a question, which is, what exams are you guys currently preparing for? And you'll see those choices on your screen. So we'll give you guys a second to answer this question. Keep in mind that our coaching service, which I'll talk about in a second, is geared towards helping you with all of these exams with our wonderful coaches like Dr. Vakaria, Mark Heslin, and various other very talented tutors. So look forward to telling you about that here momentarily. You guys will see these polls pop up throughout the webinar today. We're going to have the questions that we do. We'll ask you for those answers. So you'll see those answers on the screen just like you're seeing these now. So I'm going to go ahead and close this poll and let's see what we've got. So it looks like a lot of the people here are about 95% of you are studying for USMLE Step 1. We've got some COMLEX, some CBSA students. So welcome everybody, and let's get to it. So before we start dissecting our questions, I want to tell you what we'll be doing today. Today, we'll be using the program and the methodology we use in our RX Coach program. RX Coach is our new one-on-one individualized tutoring program. As you guys know, every student is different. Every student has different strengths, different weaknesses. You learn differently, you apply that knowledge differently, and you probably also study differently. So we have this program that's tailored to each person individually to help them maximize their study time and potential on their exams. We help you make a personalized study plan. It's a data-driven approach. We work on your knowledge, we work on your test taking and applications. We help you study more efficiently, and we help you take a more focused approach. And our wonderful coaches have helped so many students succeed along their academic journey. If you're interested in our coaching program, you can visit rx-coach.com and schedule a free consultation to discuss the tutoring program and how it can benefit you. That being said, our first question is, it's time for us to do our first question. Now, you guys will see here on the screen that the answer choices are missing, and that is by design. One of our first steps when we like to tackle questions is to cover up those answer choices. And the reason we do that is because we do not want you to be distracted by those answer choices. We don't want those answer choices to guide your thinking. And we especially want you to see an answer choice that you are not familiar with, and that causes you to panic sometimes and then throw you off your game while you're trying to tackle these questions on test day. So I've gone ahead and covered up these answer choices for you. What we'd like to do after that is read the last sentence first so that we know what we're looking for when we read that vignette, and we can take a more focused approach and save ourselves time and hopefully not have to read that question again and find those clues more quickly. So last sentence, here we go. The MRI would most likely reveal a lesion in which of the following locations? The MRI would most likely reveal a lesion in which of the following locations? Now, after we read that, we'd like our students to think, is this a one-step question, a two-step question, or a three-step question? This way you know how far back you have to go to answer it correctly. An example of a one-step question could be a question where they ask you for the diagnosis. A two-step question could be where they ask you for a treatment for a diagnosis. And a three-step question could be where they ask you for the mechanism of action for the treatment for that diagnosis. So I want you guys to think about how many steps you think this question will require for us to come to the correct answer. After we do that, we're going to read this question together. Now, normally we would read one sentence at a time and ask you, what are you thinking? What's on your differential list? And make you think out loud. Since we can't do that today because we have so many of you today, I'm going to pause just for a little bit after each sentence and let you gather your thoughts. Here we go. A 24-year-old woman with no significant medical history complains of double vision that began 2 weeks ago. However, it only occurs when she looks to either side. Additionally, she reports feeling weak and fatigued after using the sauna at her local gym over the last few months. On neurologic examination, when the patient attempts to look to the left, her right eye does not adduct past the midline, and her left eye exhibits beating horizontal movements. When she looks to the right, her left eye exhibits the same signs while the right eye beats. Her physician suspects a particular condition and decides to order an MRI of the brain. Now that we've read that, we want to read that question one more time, gather our thoughts, and then move on to uncovering the answer choices. So let's read it again. The MRI would most likely reveal a lesion in which of the following locations? I'll hand it over to Dr. Beccaria.
All right, everyone, and now we'll go through the answer choices. When going through the answer choices, we like to make sure that we start at the bottom. We start with answer choice E and work our way up. Some of you may be wondering why. The reason we like to do that is because this ensures that you go through all of the answer choices. It ensures that you don't skip any of them, you don't rush to any conclusions, and that you actually think about each one. So we are going to start with the bottom. Answer choice E, medial longitudinal fasciculus. Answer choice D, medial lemniscus. Answer choice C, frontal eye field. Answer choice B, bilateral lesion of Edinger-Westphal nuclei. And answer choice A, arcuate fasciculus. So now we're going to open up a poll. We're going to let you take a few seconds and think about the answer. Please select an answer. And then after a little amount of time, we will go over the answer.
Wonderful. And as you guys are looking at the answer choices, make sure you're thinking about the clues that the question gave you so you can use those clues to come to the correct answer. Okay, and Dr. Beccaria will shortly go over all of his answer choices and explain why the right answer is right and why the wrong answer is wrong, point out to you which clues helped us reach that correct answer. So I see you guys are still answering. I'll give you guys a couple more seconds. All right, so hopefully you guys have thought about this, entered your answer choice, and we will now close this poll and share these results. And let's see how you guys did. So it looks like a majority of us picked answer choice E, medial longitudinal fasciculus. And Dr. Beccaria, I will let you explain the correct answer, which is E, medial longitudinal fasciculus.
Thank you, Sean. So the main clues in this question, as Sean had read, were that this patient is unable to have both eyes move together in the same direction horizontally. This is called internuclear ophthalmoplegia, or INO. And basically, the two eyes cannot move together in the same direction. In young patients, when this is bilateral, it is highly suggestive of multiple sclerosis, or MS. MS typically affects young women and commonly manifests first with eye issues. Other symptoms may include optic neuritis, tingling, numbness, or muscle weakness. Anytime you have unexplained neurological problems in a young, otherwise healthy person, especially someone who's female, multiple sclerosis should automatically jump out in your brain, as in this patient presentation. You may also be wondering, why is she having fatigue and weakness in the sauna at her gym? Well, in MS, symptoms can be worsened by heat because it slows the rate of conduction through nerves even more. And this is known as the Uthoff phenomenon. So now we've determined that she has MS. So now let's talk about her eye issues. When a healthy person gazes to one side, let's say the left side, the ipsilateral eye will abduct or abduct via cranial nerve 6. Once again, the ipsilateral eye will abduct or abduct via cranial nerve 6. Simultaneously, the eye on the opposite side, or the contralateral eye, will adduct or adduct via cranial nerve 3. Once again, the contralateral eye, or the right eye in this case, will adduct via cranial nerve 3. This is done through the medial longitudinal fasciculus, or MLF. Once again, the medial longitudinal fasciculus. So to summarize, if I want to look left, while my left eye will look to the left, it is through the action of the MLF pathway that my right eye can also look left. Through this pathway, both eyes can then move conjugately in the horizontal plane. Now, in this question, we are told that this patient cannot do that. When she looks to the left, her right eye cannot look to the left. When she looks to the right, her left eye cannot do that. Thus, she is having a lesion or a defect of the MLF pathway, making answer choice E the correct answer. So now let's talk about why the other answer choices are incorrect. Answer choice D, medial lemniscus. This is primarily put there as a distractor because of its similarity in name to the correct answer. This is actually a tract in the brainstem that carries information about fine touch, proprioception, and vibration to the thalamus. It is not involved in the movement of the eye. We are also not told about any issues going on with proprioception or vibration in this patient, and thus this answer is likely incorrect. Answer choice C, frontal eye field. The frontal eye field plays a significant role in saccadic eye movements. A destructive lesion of the frontal eye field would cause both of the eyes to look towards the side of the lesion. So to explain, if a patient had a right frontal eye field lesion, both of her eyes would look to the right. We are not seeing that in this patient. The patient can look in both directions, both left and right. She is just not able to bring the other eye to join in on the fun. So thus, this is more suggestive of an MLF pathway lesion and not a frontal eye field defect. Answer choice B, bilateral lesion of Edinger-Westphal nuclei. This is responsible for pupillary constriction and lens accommodation. So while it is responsible for some ocular functions, it is not responsible for movement of the eye. In addition, there is nothing in the question that tells us this patient is having issues with pupil constriction or lens accommodation. Thus, this answer choice is also likely incorrect. Lastly, answer choice A, arcuate fasciculus. This is a tract that connects the Broca and Wernicke language areas in the dominant cerebral hemisphere. Lesions produce conduction aphasia. So a lesion of this would result in a patient presenting with language deficits. We are not told that this lady is having any issues with her language, and thus this is also likely an incorrect answer. And going back to the question, the main clues that we had here was that this woman could not look to her left and her right with both eyes. She just could not get the contralateral eye to join the ipsilateral eye. When you see this, this is internuclear ophthalmoplegia, and I want you to think of the MLF pathway.
Excellent. Thank you so much, Dr. Beccaria. So I hope you guys learned something from that. This is a very high yield topic. The INO and the MLF, they love to test on it. So make sure you're familiar with this. You get this question right on test day. Let's move on now to question 2. Once again, you'll notice that our answer choices are covered up, and we're going to start with the last sentence and read it together. These adverse effects are due to blockade of dopamine in which of the following pathways? These adverse effects are due to blockade of dopamine in which of the following pathways? As you guys start thinking about how many steps this will take, we will also begin reading the question one sentence at a time. A 35-year-old man with a history of depression and schizophrenia presents for follow-up after his medications were changed 5 months ago. He is frustrated due to new onset symptoms that have significantly interfered with his activities of daily living. Specifically, he reports feeling unsteady and restless. The patient also complains that he can't control certain movements. He denies any alcohol or drug use. His temperature is 36.8 Celsius or 98.2 Fahrenheit. Blood pressure is 116/72. Pulse is 71 and respirations are 16. On examination, the patient adopts a stooped posture and a shuffling gait. Prominent muscle rigidity is noted. There is no galactorrhea or gynecomastia. And once again, these adverse effects are due to blockade of dopamine in which of the following pathways? Dr. Beccaria.
Thank you, Sean. Once again, we will go through the answer choices. And again, we will start at the bottom and work our way up so we do not bias ourselves. Answer choice D, tuberoinfundibular pathway. Answer choice C, nigrostriatal pathway. B, mesolimbic pathway. And lastly, A, mesocortical pathway. So we'll give you all a few seconds to think about the answer. Think about, and yep, Sean has just pulled up the poll. So if you could go ahead and please select an answer, and then we will go over this again.
Wonderful. So once again, as you're looking at this question, looking at the answer choices, make sure you're looking at the clues in the question so you can come to the right answer. So we've got 4 different choices. You've got a 25% chance of getting it right, but it looks like you guys are on the right track. So far, so good. I'll give you guys a couple more seconds to come to the correct answer, and then we'll discuss it together and go over the clues in the question that helped us get to that answer choice and distractors which disqualified the other answer choices. So I'm going to close this poll and let's see how we all did. So it looks like about 78% of you got the correct answer. Looks like 78% of you picked the correct answer, which is C, nigrostriatal pathway. I'll leave it to Dr. Beccaria to explain these answer choices and the correct answer to you.
Thank you, Sean. So the key clues here are the physical exam findings. This patient is presenting with stooped posture, muscle rigidity, and shuffling gait. As we know, these are characteristic signs of a Parkinson type presentation. So why is this happening in this patient? Well, we know that 5 months ago, he had his medications changed for his schizophrenia. And we know schizophrenia is usually treated with antipsychotics. Thus, these are likely adverse effects or side effects from an antipsychotic. We know that when talking about antipsychotic medications, you can get Parkinson-like symptoms as a side effect. These are a certain type of side effects known as extrapyramidal. Many antipsychotics characteristically work to block dopamine. However, we must keep in mind there are many pathways that use dopamine. One of these is the nigrostriatal pathway. It is involved in the extrapyramidal motor loop that connects the substantia nigra to the dorsal striatum. Once again, the nigrostriatal pathway is involved in the extrapyramidal motor loop that connects the substantia nigra to the dorsal striatum. This is important because we know that in Parkinson's disease, there is depletion of dopamine neurons in the substantia nigra. Because this pathway is part of the motor loop, blockade of dopamine in this pathway, the nigrostriatal pathway, can cause numerous motor symptoms. These include dystonia, akathisia, tardive dyskinesia, and Parkinsonian symptoms, such as muscle rigidity, shuffling gait, and tremor, which are some of the signs that this patient is having. That is why answer choice C is the correct answer here. Now let's review why some of the other answer choices are incorrect. And let's start at the bottom once again. Answer choice D, tuberoinfundibular pathway. This may also seem appealing at first because it is also a dopaminergic pathway. However, this pathway works to regulate the hormone prolactin. In this pathway, dopamine works to block prolactin release. Thus, antipsychotic drugs that block dopamine here would actually cause an increase in prolactin. Thus, you could see adverse effects such as galactorrhea or gynecomastia in men. However, these are not the symptoms experienced by this patient. In fact, in the very last sentence, it actually says there is no galactorrhea or gynecomastia. Thus, answer choice D is likely incorrect. Answer choice C was the correct answer, so we will move on to answer choice B, the mesolimbic pathway. This is another dopaminergic pathway. It is thought that excess dopamine in this pathway is responsible for the positive symptoms of schizophrenia. These include delusions and hallucinations, among many others. So typical antipsychotics intentionally target this pathway. This is an intended effect to decrease the positive symptoms of schizophrenia. So blockade of dopamine in this pathway would cause a decrease in positive symptoms and is not the cause of the patient's symptoms of muscle rigidity, shuffling gait, and new movements. Thus, answer choice B is likely incorrect as well. And lastly, answer choice A, the mesocortical pathway. This is also a dopaminergic pathway, and it is involved in motivation and emotion. It is thought that abnormalities in this pathway are responsible for the negative symptoms of schizophrenia, such as a flat affect, apathy, limited speech. So blockade of this dopamine would lead to alteration of the negative symptoms, not the motor changes that he is experiencing. Thus, answer choice A is also likely to be incorrect. To summarize, all of these pathways are dopaminergic pathways. It is important to remember the tuberoinfundibular pathway regulates prolactin, the nigrostriatal pathway regulates the motor loop, the mesolimbic pathway regulates positive symptoms, and the mesocortical pathway regulates negative symptoms. Because what we're seeing here is primarily motor issues with a stooped posture, shuffling gait, and muscle rigidity, that should lean us and point us towards answer choice C, or nigrostriatal pathway.
Wonderful. Thank you, Dr. Beccaria. So as you guys can see, we've done pretty well with the last two questions. You guys are doing a great job. So let's keep the momentum going and get the other two questions that we have left right also. So it's time for question 3. So make sure you guys stick around, like I said, for the end of the webinar. We do have a raffle and a very special offer for you guys that I hope you guys take advantage of. So make sure you stick around for that. If you guys like this dissection, we'll be doing another one next week on psychiatry. So let's go ahead and do question 3. Once again, as you guys will notice, we have the answer choices covered up, and we will read the last sentence first. Which of the following is the most likely diagnosis in the neonate? Which of the following is the most likely diagnosis in the neonate? A 34-year-old woman, gravidad 3 and para 2, at 30 weeks gestation, who was brought to the emergency department after experiencing painful uterine contractions for the past hour, is admitted to labor and delivery. Despite tocolytic therapy, the obstetrician is unable to delay labor, and the patient delivers a 2,100 gram, 4.6 pound infant girl. The newborn's APGAR score is 9, both at 1 and 5 minutes. 4 hours after delivery, the infant shows signs of altered levels of consciousness, and the nurse observes that the girl's head has a bulging appearance that was not present immediately after delivery. The infant's body stiffens. Moments later, her arms and legs jerk. Which of the following is the most likely diagnosis in the neonate? Dr. Beccaria.
Thank you, Sean. The answer choices: answer choice E, subdural hematoma; answer choice D, subarachnoid hemorrhage; C, intraventricular hemorrhage; B, epidural hematoma; and A, diffuse axonal injury. So take a couple seconds to gather your thoughts, and please select an answer choice on the poll.
All right, so once again, it's important to take a look at the clues in the questions to try to come to the right answer here. And hopefully we'll do just as great of a job as you guys have done in the last two questions. Pretty impressive so far. And as you guys can see, we're using the same methodology, the same approach to each question, to have that routine, to have that method in place so that we can hone in on our test taking skills and identify if we have a test taking deficiency, what it is, and then rectify it before test day. And all of our RX coaches, including Dr. Beccaria and Mark, and all of our other coaches are highly trained, and they can help you perfect those test taking skills before test day so you can get that score you want and end up in that residency you deserve. Let's take a look at our answers and see how you guys did. So this was a little bit more of a challenging question, but it looks like half of you got it right, and the answer choice was C, intraventricular hemorrhage. And I will let Dr. Beccaria explain all the answer choices to you.
Thank you, Sean. So let's start at the very beginning, and we will see that there are a lot of clues here that will kind of point us to this answer. So in this case, a 34-year-old pregnant woman delivers an infant at 30 weeks. So this means that infant is premature. The infant is also only 2,100 grams, and thus is classified as having low birth weight. Now remember, our cutoff is classically 2,500 grams or less. So we know automatically that because this infant is premature and has low birth weight, the infant is going to be at risk for a few things: infections, respiratory distress syndrome, necrotizing enterocolitis, persistent fetal circulation, and intraventricular hemorrhage. These are things that we would be thinking about even before we get to the answer choices, just by those clues given to us in the first couple sentences. Now, let's go to the case. Initially, this child or this newborn is stable, but then 4 hours later has a bulging head and develops a seizure. So we know there is something going on that is increasing pressure in the head, such as a bleed. These symptoms, in the context of a premature and low birth weight infant, are highly characteristic of an intraventricular hemorrhage, a major complication of prematurity. Thus, answer choice C is a correct answer in this question. Now let's review why the other answer choices are incorrect. Answer choice E, subdural hematoma. These are caused by rupture of bridging veins, and these are usually secondary to trauma and are commonly seen in the elderly and sometimes in shaken baby syndrome. So what tells you that this is not a subdural hematoma? One, this is a newborn, not an elderly, and there's also nothing in the presentation about child abuse. On top of that, and importantly, this occurred after 4 hours. Subdurals are slow venous bleeds. Thus, answer choice E is likely incorrect. Let's talk about answer choice D, subarachnoid hemorrhage. This refers to bleeding that is often caused by the rupture of an aneurysm or an arteriovenous malformation, or AVM. There is nothing in this presentation about this newborn having a condition, or the mother having a condition that could predispose the infant to aneurysms or AVMs, such as Ehlers-Danlos syndrome, polycystic kidney disease. Thus, answer choice D is likely incorrect as well. We already talked about answer choice C, so let's move on to answer choice B, epidural hematoma. These are due to rupture of the middle meningeal artery and are often due to a skull fracture or trauma. There is nothing here to indicate that there was any trauma or fracture during delivery. Thus, answer choice B is likely incorrect as well. And lastly, answer choice A, diffuse axonal injury. This is caused by traumatic shearing forces during rapid acceleration or deceleration of the brain. It's most commonly seen in car accidents, child abuse, shaken baby syndrome, and the patient presents with a devastating neurologic injury. So the patient will often be in a coma or a persistent vegetative state. One, there is nothing in this patient presentation about any of the inciting factors we just talked about. And two, there is nothing about the neonate or the newborn being in a persistent vegetative state or a coma. Thus, it is likely that answer choice A is also incorrect here. So the key point here is recognizing that this patient was a premature and low birth weight newborn. And right after that, things should be popping in our head as to what they are at risk for. And in this situation, it ended up being an intraventricular hemorrhage.
Excellent. Thank you so much, Dr. Vicaria. So that was a little bit of a more challenging question. We did a couple earlier that were a little bit easier. But now that you've gotten used to our methodology, we wanted to give you something a little more challenging, because all of your questions on test day won't be a walk in the park, right? Which is why it's so important that when you're doing questions, you're learning from them and reviewing why the right answer is right and why the wrong answer is wrong. Because oftentimes, if you have good test taking skills, even though you don't know the right answer, you can come to it. And our RX coaches are so good at training you on those test taking skills and working on your knowledge. So once again, if you want to have an RX coach like Dr. Vacaria, please visit rx-coach.com to schedule a free consultation about our tutoring program and learn more about it and how it can help you. We've had so many students even break 250s using this program, and I'm sure we can help you too. So we're gonna do one more question together, and then after that, we're gonna give away some free stuff, and who doesn't like that, right? So let's do one more question. Let's see if we can get it right, and let's give away some free stuff, and we have a really nice special offer for all of you. So make sure you stay tuned after the question. So here is our last question. What is the likely mechanism of action of the prescribed medication? What is the likely mechanism of action of the prescribed medication? A 25-year-old day laborer on a fruit farm is brought to the emergency department by a coworker because he is having diarrhea and difficulty breathing after their lunch break. His heart rate is 50, blood pressure is 80/60, respiratory rate is 23, and temperature is 36.9 Celsius or 98.4 Fahrenheit. On examination, he is diaphoretic, drooling, and unable to answer questions coherently. Orders a medication for urgent treatment of this patient's condition. What is the likely mechanism of action of the prescribed medication? Dr. Vacaria.
Thank you, Sean. So again, we'll just read out the answer choices. Answer choice E, regenerates acetylcholinesterase. D, nicotinic receptor antagonist. C, nicotinic receptor agonist. B, muscarinic receptor agonist. And lastly, A, inhibits acetylcholinesterase. So we'll give you a few seconds to gather your thoughts. Please select an answer choice on the poll.
All right, so once again, a little bit more of a challenging question, but an important one. All the topics we've covered today have been very high yield. And so even though it's only one question, or in this case, 4 questions, we've covered a lot of different topics, and now we'll be covering several agents or mechanisms of action. So remember that as you're doing these questions, though, even though it's only one question, you can learn a lot from each one as you're practicing. And you can learn about the content, but you can also learn about yourself and see if you can identify patterns as to why you're missing these questions. And like I said, if you need that help, we're here to help you through rx-coach.com. Looks like a lot of you guys have answered this question already. I'll give you guys a couple more seconds to type in or to select your answers rather. And then we'll take a look and see how we all did before we move on to our raffle and a great special offer for all of you. So let's take a look and see how we did. Looks like this was a pretty challenging question. We've got a pretty even split here. The correct answer is E, regenerates acetylcholinesterase. And I'll let Dr. Vacaria explain that and the other answer choices to you.
Thank you, Sean. So like Sean mentioned, this was a little bit more of a challenging question. So this patient is presenting with a constellation of symptoms, including difficulty breathing, diarrhea, bradycardia, hypotension, drooling, and diaphoresis. These are all various signs. Now, it's important that we try to think of why this is going on. How can we tie this together in this question? Why are they giving us all these clues? These are all signs and symptoms of excess cholinergic activity. Remember, increased cholinergic effects can be remembered using the mnemonic dumbbells, and we'll kind of quickly run through that right now. Diarrhea, urination, meiosis, bronchospasm, bradycardia, excitation of skeletal muscle, lacrimation, sweating, and salivation. This patient is having many of those. So we have now identified that this patient is having cholinergic excess. Great. The key point here is trying to figure out how. Well, they did mention to us in the epidemiology that this patient works at a fruit farm. This is a classic work-related exposure resulting in cholinergic toxicity. He is most likely suffering from acute organophosphate poisoning or a related insecticide at his farming job. What do organophosphates do? They irreversibly inhibit acetylcholinesterase. Once again, they are irreversible acetylcholinesterase inhibitors. Thus, if you are inhibiting acetylcholinesterase, whose action is to break down acetylcholine, you will have increased acetylcholine activity or increased cholinergic stimulation. The antidote for organophosphate toxicity consists of atropine and pralidoxime. So let's talk about atropine first. This is a competitive inhibitor or competitive antagonist of muscarinic receptors. Notice that this was not provided as an answer choice. There was an answer choice that said muscarinic receptor agonist, but there was not an answer choice that said muscarinic receptor antagonist. Let's talk about pralidoxime. This is a compound that regenerates active acetylcholinesterase. Thus, answer choice E is a correct answer here. Now let's review the other answer choices and why those are incorrect in this question. D, nicotinic receptor antagonist. Examples include pancuronium, atracurial, and these are used most commonly for muscle paralysis during surgery or mechanical ventilation. These drugs would not treat or reverse this patient's conditions as they only target nicotinic receptors. A lot of the effects that we are seeing in this patient are due to action at muscarinic receptors. So it's important to differentiate muscarinic and nicotinic in this question. And in that case, answer choice D is likely incorrect. Answer choice C, nicotinic receptor agonist. An example would be succinylcholine. This is also used to achieve muscle paralysis during surgery. It is a strong acetylcholine receptor agonist, and thus it would increase acetylcholine activity also. We don't want that in this patient. We do not want to increase acetylcholine activity. We want it to decrease it. So thus, answer choice C is also incorrect. Answer choice B, muscarinic receptor agonist. We touched on this briefly, but muscarinic receptor agonists would include carbachol, bethanechol, agents like that, and they work to increase cholinergic activity. They would thus worsen this patient's symptoms. Keep in mind, this did not say muscarinic receptor antagonist, which would be atropine, for example. And in that case, that could have been a correct answer, but that is not listed here. And lastly, answer choice A, or inhibits acetylcholinesterase. An acetylcholinesterase inhibitor, like pyridostigmine, that would work the same way as the organophosphate toxin and would work to increase levels of acetylcholine. As we mentioned, that would worsen this patient's condition as well and is also an incorrect answer. To summarize, it is important to recognize the constellation of symptoms and clues that they gave us to recognize that that is cholinergic toxicity. It was also important to recognize the epidemiology and how he got in this situation. It is then also important to know the treatments of atropine and pralidoxime and how those specific agents work, and then also specifically the physiology between muscarinic and nicotinic receptors, and to discuss antagonists and agonists like we just did.